name is Kim Gilhooly. I work at the Public Health Institute of Western Massachusetts, and I am the Data to Policy Action Director.
What is your organization doing to understand the impact of having a CORI on older adults in Western Mass?
Well, we are just in the process of completing a health impact assessment of that exact issue of the health and equity impacts of the practices and policies around using criminal background checks in affordable housing decisions and how that impacts older adults in Hampden County.
What are the possible solutions and policy strategies to address the equity impacts of an older person living with a CORI record?
Well, before I talk about those, I might say a few of the things that we found in the health impact assessment. So just to say, we looked at 6 different policies and practices, and I'll talk about those when we get to the solutions, but we first kind of step back. We actually had to start by defining what older adult means. And because the experience of having been incarcerated and the experience of homelessness both prematurely age people so much that we actually found ourselves defining older adult as age 50. And additionally, we found that both of those experiences, not just incarceration, but having been arrested, convicted, incarcerated, even being incarcerated for longer amounts of time, as well as the experience of being homeless, affect people who are Black and Latinx in Hampden County and across the world at much higher rates. So this is a huge equity issue. So those are a few of the findings. We also found, interestingly, I didn't expect this, but that people who are older actually have a much higher risk of homelessness and housing instability after incarceration. And at the same time, they have a much lower risk of recidivism or committing another crime. So, for example, in the state of Massachusetts, the Massachusetts Department of Corrections, in the general adult population, about 28% of people recidivate after 3 years of returning from prison. And if you're over age 55, about 8% do. So it's much, much lower risk for housing providers to be renting to older adults. So those are a few of the findings, just to put it in context. A couple other things, this will come as no surprise, but there is a huge lack of affordable housing for everyone. But in particular, because of policies and practices around the criminal background check, it really impacts people who have a criminal background who are Black and Latinx at higher rates.
Are there any larger equity findings you would like to share?
Well, I mean, in addition, the racial equity issues are clear. There's also the fact that we did a survey of people who were over age 50, who had had the experience of either being denied or having trouble getting affordable housing due to their criminal background. And one of the things we asked is, what is your income, your annual income? And a large majority said $15,000 or under. And that is true across the country, that if you've had the experience of being incarcerated, it's harder to find a job. And incomes that's about what it is across the country, is less than $15,000 for people who've been incarcerated. And so in addition to being a racial equity, because more of those people are Black and brown, it's a socioeconomic issue. And so obviously if you're not making a lot of money, it's hard you don't have much choice for housing.
What are possible solutions and policy strategies to address the equity gaps on older adults that you recognize?
Well, that's the good news, is that there's actually a lot we can do. And some of it is simple and local, and some of it is, at the state level. Some of it is more complicated. But some of the, maybe low-hanging fruit include, what we found is that while housing authorities are willing to consider people who have a criminal background, and they have policies in place around criminal background, that it's actually pretty challenging to find that information out. And even though housing authorities told us when we interviewed them what their policies were and where you could find them, for people that had had the experience of being denied housing because of their background check, it wasn't that easy to find that information. They were confused about it. And even housing authorities across the state, including locally, told us that it's so helpful if people have either a legal advocate or a housing navigator to help them through the process. In particular of presenting what are called mitigating circumstances if they do have a criminal background. Let's say they were arrested for something having to do with drug possession and they are in recovery and they have documentation that shows that. That's what's called a mitigating circumstance, that they can prove to the housing authority or the housing provider that they are not a risk. What housing authorities said, it's so helpful to have someone helping the person present those mitigating circumstances, navigate the housing application, etc. And I think that's a little bit evidence that it's actually difficult to do that. And if you have a mental health issue, if you have a substance use disorder issue, if you're homeless, like all of those issues tend to lead to behaviors that get people arrested, even though they're health issues in and of themselves. But if you're dealing with that, to be able to navigate this complicated housing application is pretty hard. So our recommendation was just make it a little easier. Put those absolute disqualifying crimes right up front on the application. Make sure your housing staff, and some of them are, but make sure your housing staff are trained in how to read a criminal background to know that not everything on there is applicable to the housing application. Increase funding for housing navigators or legal aid, not only to help individuals, but actually to do education to the larger community around how do you apply, what are the barriers, if you're turned down, what can you do, those kinds of things. So those are some of the, what I would call lower hanging fruit, they're kind of more local. But also on a state level, of course, funding could be increased for all sorts of things. So one of the things that we found that exists in Hampden County and is well accepted by housing providers, by people who use the services, by advocates, is partnerships between housing providers and reentry service providers, behavioral health providers, substance use treatment disorder providers, and mental health treatment providers. And what that looks like is like a housing provider would provide either vouchers or actual housing units in partnership with, for example, Gandhara Mental Health Services, who operates several different types of housing, like Miracle House, for people in recovery, many of whom have criminal backgrounds, or another provider, homelessness reduction providers. So, for example, the Worthington Street Shelter gets, I think, about 100 unit vouchers from Springfield Housing Authority. And the reason those partnerships work well is because they, there's someone else involved in one's life to either help them along or to provide services. And so all parties seem to like that, to have that other person involved. So we would recommend expanding those types of partnerships, which requires funding. The other thing is just expanding the amount of money that is available for reentry housing. There is a line item in the state budget that goes to the Massachusetts Probation Services, and then they farm it out to a provider, and it's purely for reentry housing. And so we think that could be increased. And then also the types of housing providers and service providers that funding goes to could be expanded, because right now it goes to basically one organization. And I would say it should be expanded to people who are formerly incarcerated who are opening these types of services. I don't know of any in Hampden County, but I know of other examples across the country. The last thing I'll say about these partnerships is that they're really evidence-based. Like, what we've found is that nationwide, from the literature, they reduce risk of crime, of recidivism. They help people maintain stable housing. They even reduce people's use of the emergency room and jail. So one last recommendation I'll talk about is kind of related to that, is that none of this is of any use whatsoever if we don't have housing. So there's a couple of recommendations for increasing affordable housing through incentivizing investment in it. One is a bill that's in the legislature right now, HD 4041, which basically uses a low-income housing tax credit to encourage developers to develop affordable housing and set aside 5% for people with a criminal record. Another idea came from Keith Ferry, the executive director of Wayfinders, a housing provider. He, in a past life, worked on a Pay for Success project that built housing for people with a criminal background, using this idea of, we know it's evidence-based, so if investors invest in this housing, they will get their money back. So that's a bunch of, there's actually many more recommendations, but those are some of the options.
How can we make these solutions and policy strategies a reality? What support, both monetary and beyond, does your organization need to decrease the equity gap for older adults living with a CORI record?
It won't happen if we don't work together. So what we found in the HIA is that there was a power in bringing all of these different people who may not talk around the table to talk. So we had Housing Authority, we had Wayfinders, we had people who have been directly impacted themselves and advocate for others who are so impacted. We had service providers through all-inclusive support services, which is also part of the Sheriff's Department in Hampden County, and legal advocates. So we had all those people around the table talking with each other, and we didn't always agree, but what I heard in talking to housing providers and talking to the Massachusetts Department of Housing and Community Development, and talking with the Executive Office of Elder Affairs, is that people are willing to work together. So we have a bunch of recommendations. We just need to convene people and see what they feel is feasible, what they can expend their political will on, and work together to support policymakers and decision makers to do that. So I think convening takes funding too, but the real thing is, like, if we have to work together to do this, because I think it can happen. We heard from housing providers that people who are especially providing public housing are there because they want to help people who have the lowest incomes, and people who have had the experience of incarceration or arrest tend to have lower incomes because of all the barriers put in their place. So we heard that people want to help. It's just providing them with a little extra influence to get that to happen.
Is there anything else you would like to share?
In terms of all those solutions I talked about, I don't think I really specifically mentioned older adults. So there's a couple things about older adults. One is, one of the advocates that we talked with immediately upon hearing what we were studying said, well, people who are over 50 should get an automatic mitigation, meaning that they shouldn't actually be required to produce documentation that they're a risk because there's such a low risk for crime. So that is a recommendation that we have, is that people applying for housing are given a pass on their on their CORI because of their age and their low risk for recidivism. So that's one thing. And then the other thing is we did recommend that some of these programs, like the partnerships I talked about, start with a pilot that targets older adults and be thoroughly evaluated so that we can see, and I would say kind of prove, that these partnerships are going to work. A partnership I didn't talk about, or not a partnership, but a pilot that we're proposing is letting people come home to live with their families in public housing. And so we feel like if we start a pilot in one of our Hampden County housing authorities, letting people come home, letting people who are over the age of 50 come home and live with their family members in the same way that the New York City Housing Authority has done, and then we evaluate it, then it could be, not only get a few people housed, but it would be evidence across the state for other people to do this. So a lot of these different recommendations, we want to do as pilot programs with people over the age of 50 and then expand beyond that. One thing I didn't talk about is way back when I said a few of the things we found is that a lot of people are actually affected. So we found that there are about 5,600 people annually in Hampden County who are either returning from prison or jail or just on probation. And that's all adults over the age of 18. But we wanted to look at that because we heard in our survey with people who had experienced this problem who were over 50 that the experience of having this barrier to accessing housing because of your criminal record happened to them even 10, 20, 30, 40 years after the crime, whether or not they had recidivated or committed another crime. So if someone commits a crime and gets arrested at age 25, at age 50, they could still be experiencing this barrier to getting housing. So we thought it would be better to actually look at every adult, all the adults who have this, who have a criminal background, and not just the people who are over age 50 right now.